How's it going, guys? Dr. Nick here with Dr. Brady, and today we're going to be discussing golfer's elbow or medial epicondylitis. So what golfer's elbow is a tendinopathy to the common insertion point of the wrist flexors. So that's going to be right into the medial aspect of the elbow. A lot of these people that come in with it describe a burning or a sharp kind of achiness right over the medial aspect of the elbow. Hurts worse with like gripping things or holding things. Any sort of wrist flexion, bending that wrist up is going to cause a lot of pain. And so golfer's elbow is classified as a tendinopathy that's broken down into two things. A tendinitis, which is the early onset that transitions into a tendinosis, which is the more drawn out kind of chronic issue. So if you come to us with golfer's elbow that happened a week ago, you're out at the golfing range, golfing course or whatever, and you're hitting some balls and your club head's really kind of chunking through the dirt and causing that wrist to jolt back, rapidly stretching these muscles through here. You're going to cause a little bit of micro tear, going to cause some inflammation. So with being within a week, it's fairly acute. So what we would do for you here is we would dry needle this tissue, followed up with laser, get you out on the rehab floor. So the acute stuff, the tendinitis aspect of golfer's elbow could really be easily managed with dry needling and laser. Dry needling is good at dilating some blood vessels, irritating the tissues a little bit in a good way to tell the body, hey, we need fresh blood here, we need to work on healing this area. Follow that up with the laser. Laser is great at allowing the tissue to utilize that fresh blood. So it kind of, in a roundabout way, expedites the healing process. So if you can get on top of it early, it's very, very easily managed. But if you let it get drawn out, you kind of go a couple seasons of golf and, it finally gets you, you're like, I'm tired of dealing with this. That's more of a chronic issue. And so what we would do is a little bit more of an aggressive approach. We would shockwave this tissue. Shockwaves, more aggressive in the sense that it's really breaking apart some of those sticky adhesions, that scar tissue, kind of cobweb-like stuff that gets laid down when tissue is torn, then healed incorrectly. So shockwave is really good at kind of bringing it back to square one with the healing process. So shockwave, followed up with laser, and then get you out on the rehab floor. The rehab's going to be a little bit longer in this case just because if it's a chronic issue, but if done appropriately, we give you the tools to really kind of manage this on your own outside of here, and hopefully it doesn't come back for you. But if you guys have any questions about golfer's elbow, leave them in the comments below. Be more than happy to answer them for you. Brady, is there anything else you want to add to that?
Yeah, if you could help my golf game too, that'd be great. But no, it's a really good time, especially this time of year right before golf. So get in here if you're dealing with this, and it's not something like Nick said that you want to prolong, because then it could potentially get worse there.
Yeah, right. Absolutely. We look forward to seeing you in the next video, guys. Take care.
All right.